Okay, to all my viewers, we'll discuss the various aspects of HIV testing today. Firstly, let me elaborate on why it is essential to get HIV testing done, where this test should be done ideally, and then what are the different interpretations of a positive test and a negative test. This is the most important aspect of HIV/AIDS, that is, because to avoid a misinterpretation of a test, to avoid an improper place where a testing is done, and an improper indication for a HIV testing. So it has got a bearing on all these things. Firstly, now let us know who has to get tested for their HIV status. A person who had unprotected sex with a stranger, whether it is a heterosexual encounter or a homosexual encounter, even if it is one or a repeated sexual encounters with unprotected sex, definitely needs HIV testing, even though the patient may be asymptomatic. The second important indication is persons who are having a history of intravenous drug abuse and who are sharing their needles repeatedly, because the risk of getting HIV is 0.3% if you are sharing the needles, or even improperly sterilized needles, even when there is no intravenous drug abuse, can itself cause HIV if the needle is already been used by a HIV positive patient. So here one has to understand that HIV, the risk is 0.3%, but for hepatitis B it is 30 to 40%. So please remember this particular point. The third important indication is if anybody is having a fever more than 1 week to 10 days, associated with weight loss in the last couple of weeks, associated with flu-like symptoms and symptoms of diarrhea and sweating, or evening rise of temperature for the last 10 days or 15 days, definitely needs to get their HIV status tested. And once more, that if it is happening repeatedly. So one has to understand here that there is something called a window period in HIV/AIDS. In the last, after the infection has come into the body, 4 to 6 weeks, most of the patients are asymptomatic. So therefore, they won't have any symptoms. So obviously nobody gets tested. Once they have symptoms, the window period is already over, and then the test may be positive. So this is the third indication. The most important indication in the clinical practice is all antenatal women, that is all patients who are pregnant, need to get their HIV status tested immediately in their first antenatal visit. The second question which begs an answer is where you have got to get this testing done. It's always wise to visit your nearest ICTC center. You can Google it and you can find it on the net. Why it is important? Because there is something called a standardization of HIV testing. Any private labs, with due respect to all of them, most of the labs are not having a standardized HIV testing. But in the ICTC center, which is approved by NACO, this standardized testing is done. Therefore, it is all the more important to visit an ICTC center where your confidentiality is maintained and assured, and your privacy is protected, and you will be treated with dignity and respect. That is what is important. The interpretation. Always go to your personal physician or to a qualified HIV/AIDS physician or an internal medicine expert or an infectious diseases expert when you have the HIV test with you, because a wrong interpretation may lead to a lot of complications. So please understand that a proper interpretation by your physician or your counselor is important. So a positive test does not mean the end of life. there is a lot of life beyond a positive HIV testing, because newer drugs, ART drugs, have made sure that the viral load is undetectable after a couple of months of using this ART, though you have to use it lifelong. So you can lead a normal life, you can do your employment job and everything can be done. You can live a long and healthy life. So please remember that a proper interpretation by a qualified expert is important. So in ICTC center, if 3 tests are done and all are positive, it means a positive test, so that your physician will know it. So one test, you need not jump to any conclusion. Secondly, if you have got a negative test, kindly repeat it after 6 weeks. This is the interpretation part of it. And always have a good communication channel with your physician or your counselor so that all your doubts can be answered. It's more important to have a communication channel than anything else. So please remember this point very, very clearly. You should have a 24/7 contact with your counselor or your physician. Secondly, if a patient is antenatally positive, pregnancy HIV test positive, ART can be given to her and her quality of life will improve and the baby also will be born negative. Therefore, after the advent of ART, most of these patients or majority of them can be accepted into the community like anybody else without any stigma or discrimination. They can lead a normal life, they can do everything what we are doing. That is what I wanted to tell in this particular podcast. So that is the importance of knowing how to interpret a HIV test and the importance of ART and having a good counselor to ensure a good quality of life free from stigma. In my next video, I am going to discuss in detail about the implications of a positive HIV testing and what should be the mindset in having a positive HIV test and whom to contact, and the various implications regarding the counseling and proper interpretation of a HIV test and how it can impact your life. Thank you.